I am Dr. Helal Uddin Ahmed. I am psychiatrist. I am working in the National Institute of Mental Health as an associate professor of child, adolescent, and family psychiatry. And I am the Secretary General of Bangladesh Association of Child and Adolescent Mental Health. Welcome to the learned participants in the Bangladesh International Medical Students Scientific Conference 2020 Virtual Editions, organized by the International Federation of Medical Students Association Bangladesh. And I am giving my thanks to all the organizers and all the participants and the delegates. Actually, this BIMSSCON conference started in 2015, and this is the fourth virtual online conference this year. And we are passing a very hard time in the entire world due to the COVID-19 pandemic. And I'm congratulated to the organizer to arrange this such a good conference in these situations when we are facing a very trouble time in the COVID pandemic, but they are doing a very good job in their own scientific view and exchange the scientific view to the other countries, to the other abroad and Bangladesh and international delegates. Thank you to the organizers again, and thank you to the participants for inviting me to say a few words in this conference. And my today's topics, I am talking on the social and emotional intelligence and interpersonal dealings for the medical students and for the other healthcare professionals and in our professional lives. I am starting my talk today, the interpersonal dealings, social and emotional intelligence. What I am telling today, that my topic is what is interpersonal dealings and why we need interpersonal dealings skills, general and the medical professions, and social intelligence and emotional intelligence. What is the meaning of social intelligence? What is the meaning of emotional intelligence? And optimum use of social and emotional intelligence by the healthcare professionals and the medical students and others. And last, I conclude by some take-home messages. And first, I want to say what is the interpersonal dealing. The interpersonal is of the interpersonal communication, interpersonal relationship, and interpersonal skills. Actually, all are same things. The interpersonal dealings are skills or communications or relationship. And the interpersonal dealings, we can define it by skills we use every day when we communicate and interact with the other people, both individually and in groups. The interpersonal dealings include a wide range of skills, but particularly communication skills such as listening or effective speaking. They need to be a very good listener, also a very good speaker. That persons is very good in the interpersonal dealings. They also include the ability to control and manage one's emotions and accommodate others' emotions. That's very important, to play with the emotions. By own emotions regulations and accommodate the others' emotions, they can understand the emotions of other persons, the community, and the group. That is very personal dealings. That's what I say. The skills of interpersonal dealings communicate with the personal level or with the group level. It is the particularly communication skill for the listening and for the good speech, good speakers, and also the ability to control and manage one's emotion. That is again we come to the emotional intelligence. And why interpersonal dealings are important? It is important for the general populations and also important for the professionals, for the medical professionals and other professionals also. And we are confined in our talk into for the medical professionals, interpersonal communications for medical professionals. And first, I want to say the interpersonal communication for medical professionals are important for their own life, their family life, their friends and family life. Then it is important with their patients and the patient relatives, how they communicate with the patients and patient relatives, and also in the workplace with the co-workers, their colleagues, their juniors, their seniors, and others, and also needing the social interactions with other professionals and in the community, like the journalists, like the police, and like the others. That means the interpersonal communication for the medical professionals are multifaceted, and that is their own life, their family, their community, their workplace, and others. And why interpersonal dealings are important, we said it is continuing that it is the positive rapport between the patient and the service provider, that's in the healthcare providers. Disclosure by the patient of sufficient information to make an accurate diagnosis. It can go the good interpersonal dealings can goes to the very good, accurate and appropriate diagnosis. A medically appropriate treatment or action acceptable to the patient, and understanding by the patient of his or her condition and prescribe treatment regime. It is also very good, good component of the interpersonal dealings of communication. Otherwise, the non-adherence will be occur. The patient will not take the medications, patient will not adhere with the treatment. The commitment by both patient and providers to fulfill their responsibilities during treatment and follow-up on care. These are the causes why the interpersonal dealings are so important. And medical training, we have need always say the doctor, the medical professions, they're very noble professions. Doctor are very noble person. They are very good human being, and the humanistic attitudes need to be a doctor, need to be a medical professions. But the humanistic attitude is depends on the interpersonal skill. Otherwise, it will be not applied to the persons or the patients or the other persons. That is the humanistic attitude, that interpersonal skill, that the relational competency will be good. Linguistic fluency is important, communication skills, interpersonal skills, the vice versa, that all goes to the very good professions, good professional outcome, that is the very good doctors by the natures of his interpersonal relationship and the relational competency with the patients and others. And humanistic attitude are not sufficient for the highly demanding transactions that take place in the healthcare encounter. Not enough. Humanistic attitude is not enough. Need to conduct an efficient interview and are prepared to witness and tolerate patients' distress that cannot relieve. That means we need to be a very good listener, good speaker, and we can share our own emotion and we can accommodate the emotion of the patients. Otherwise, medical professions will be not working. And the interpersonal skill set, there are some domain, some core attitude and some interpersonal skill. I want to give some example here. If our interpersonal skill, we need to be understand one patient, that is understanding. Our core attitude should be the curiosity. We have to know something from the patient's carer and other persons and something. And our domain is of this understanding in our head, in our brain, that is the cognitive domain. That means the cognitive domain, core attitude is the curiosity, interpersonal skill we belong, that is the understanding, good understanding. Like this, when we develop our empathy, so we need the caring, that is the core attitude, and the domain is the affective domain. That means the emotional domain. Affective means the emotional domain. So we should nurture our emotional or affective domain. Our attitude will be the caring, and the interpersonal skill will be develop the empathy. Like the behavioral domain, the respect to others, respect to the patients, respect the patient carer, respect to my colleagues, respect to my family members, respect to the community people. That is the relational versatility. That means the person is very versatile relationship with many people. That is the three domains I give them example, like the cognitive domain, affective domain, and behavioral domain. And the core attitude is the curiosity, caring, and respect. Then we develop our interpersonal skills and the understanding, empathy, and relational versatility as per their domain and core attitude. That's the one skill set I give some example here. And actually, if you are a very good doctor or very good medical students, your result is very good, your clinical eye is very good, your answer script is very nice. That is the instrumental communication. That means the purpose of the instrumental communication is to translate the content of the healthcare. You know everything written in your book, you know that. You are very good in the memorize the lecture your teacher said. That is the instrumental communication actually. But we need the interpersonal communication, that is establishing an optimum emotional fit with the other persons. Typical channel of the instrumental communication is the verbal or written. Our interpersonal communication mostly non-verbal, our attitude, our gesture, our posture, our eye contact. That's the instrumental communication. The language is abstract and symbolic. Our interpersonal communication, the language is iconic and analogic. The instrumental communication, the intention was primarily deliberate. We deliberately say something or deliberately ask something, but interpersonal communication is spontaneous. Assessment sourced by expert observer. What is the instrumental communication? Like that, your examination, your prof, your card, that is the instrumental communication. But the interpersonal communication is not by the expert observer, it is the participant experience, who those are participant in this communication. Realm of the medical practice, the instrumental communication is the science of medicine, and the interpersonal communication is the art of medicine. That means that it is a very, very soft skill we have to need. The interpersonal communication is the art of the medicine. And how can we develop our interpersonal dealings and interpersonal communications? That is, the express yourself, dissemination of the accurate information with the person you want to communicate. That means the person with maybe the patient carer, your colleague or others. You have to say the accurate information and transform the information in knowledge. Own and others' well-being is very important. You have to in sound mind, in sound body. And at the end of the day, the interpersonal communication has some productivity. Without productivity, it is useless actually. Time management is important, not too many time or not very short time. It is a very rational time management needed for the good communication skill. We say the KISS method. KISS method means keep it short and simple. Your communication should be the very short and simple. And the cost effectiveness, personal, social, and professional development by this communication. And at last but not the least, being a human, not a machine, by this interpersonal dealings and communication. And it's very important, this communication skill, to diagnose of a patient, to assessment and evaluation of a patient, to manage and follow up the patient, and that to give a good workplace communications to with colleagues and workers, and also very needful in the conducting any research and personal life also. You can use this interpersonal dealings in your personal life. There are many protocols for this interpersonal communications. One I said, that is the class protocol, and 5 key steps of the clinical interview. Class C means the context, the physical setup of the area you choose for the interview. When you talk with your patients, talk with your patients' relatives or care, your worker, your family members, you need a very good positive environment. That means the context. And L means the listening skill, how to be an effective listener. A means acknowledge, how to validate, explore, and address emotion and concern. S means strategy, how to provide a management plan that the patient can understand. And at last, S means summary, how to summarize and clarify the conversation, ensuring the comprehension, that the paraphrasing and others, and the shortly say what the patient or the patient carer or the other person say, you can summarize those. And this is the example of the good context of a interpersonal communication. Good context is face-to-face, saying, taking sitting position and the room environment and etc. Very good context. Another good context is like that. Very good context of interpersonal communication. Very good communication. The environment, not face-to-face. It is by side is the good. The in front of the physicians and in front of the patient, very good in line. That is the space, open space is needed. It also very good context. And acknowledge the emotion, that is the explore, identify, and respond to the emotion of the patient. That is the empathetic response, not the sympathetic. Identify the emotion of your persons who want to be communicated. Maybe the patient, not maybe the patient, your friend, your co-worker, or anybody. Identify the cause of the emotion. Respond by showing you have made the connection between the emotion and the cause. That is when you can use the word that must be felt terrible when you get the pain and others like that. And listening skill is very important. You should go to the open-ended questions, not by the closed-ended question. Paraphrasing and clarifying what the person said again. Check the understanding. You can understand, or the other person can understand what is the conversation between two of them. And facilitating the session is good. and time and interaction. Not too many time, not too short time. I said previously, it is a very rational timing and interruption time by time to the person you wanted to say something. Then you take permission and interrupt to say a few words. Strategy is the purpose of a plan that the patient will understand. Appraise in your mind and clarify the patient that expectations of treatment and outcome. Decide what the best medical plan would be for the patient. Recommend a strategy on how to proceed. Evaluate the patient's response. Collaborate and agree on the plan. That means the plan should be discussed with the patient, not keep it in your mind also. You should discuss your treatment protocol, treatment modalities with the patients and the caregivers. And last, the summary, that the closing the interview, final thoughts, summarize the discussion in a clear and concise manner, check the patient's understanding, ask if the patient has any other questions for you, and if you don't have time for further questions, suggest that they can be addressed in the next appointment. Make a clear contract for a follow-up visit. We should not follow always this final thoughts, these steps, but we should accommodate a closing sessions, a closing summarize the talk towards the patients or the patient caregivers or other person. Before the end of the session, you have to summarize what the conversation between you. And top 10 communication skills are active listening, non-verbal communication, your gesture, posture, eye contact, clarity and conclusion, culturally competency, confidence, empathy, open-mindedness, respect to others' thoughts and others' beliefs, feedback, and using right medium, the verbal medium or the video or the audio or the multimedia, anything. Use the right medium with the patients or the written form, anything. There are some communication barriers during the interpersonal skills. One is the inattention, not giving the attention to what you want to be communicated, or selective perception. You just attend is a single word or single portion what you said or they say. That is a very one communication barrier. Poor expressions, language, premature evaluation. Before hearing the whole story, you have some preoccupied thoughts and premature evaluation. That's very dangerous for the clinical practice. Emotions. Sometimes you are emotionally attached with the persons you want to be talked. That is a very not very ethical and not very professional. Not attached emotionally. You can accommodate his or her emotions, but not attached emotionally. Inconsistency sometimes, information overload. Many information. Some are essential, some are not essential. There are some physical barriers. That time during this COVID situations, our communications had some physical barrier that we are communicate over phone, over online platform. That is the physical barriers also. Insufficient warning. That means we are not warned about the time management and others. Lack of feedback. Insecurity. That means lack of confidentiality. There is the unethical some approach. If confidentiality breach, we should have to maintain the confidentiality. And there is the individual difference, person to person difference. Interpreter validity is sometimes not maintained. That the individual difference also occurs in the communication. This is the main communication barriers. We have some cultural competency. We need some cultural competency. That is the very one component of very good interpersonal communication. Before you want to communicate with one person, his or her culture should be considered in your mind. That is the journey rather than objective set in stone. Value and respect for individual, changing attitudes and behavior, sensitive self-reflection, and cultural efficacy. All are important for cultural competency. Now I want to say a few words regarding the social and emotional intelligence. Social or interpersonal intelligence is the sensitivity towards others' moods, feelings, temperaments, and motivations, and ability to cooperate as part of a group. That is in the social group or the person-to-person group, one-to-one, 2 persons or more than 2 persons. And the emotional intelligence is the ability to monitor one's own and others people's emotions, to discriminate between different types of emotions and label them appropriately. and to use emotional information to guide thinking and behavior. That means one person's emotion we have to consider our mind, and my behavior will be like that in the line of that emotion. One person is angry, so my behavior is to be try to calm down him or her. One behavior is very euphoric or he is very happy, I also be very happy with him or her. That is the one's emotions and my behavior. That is very important to the emotional intelligence part. In case of social or interpersonal intelligence, that is the extension or superset of emotional intelligence. It is the extension of the emotional intelligence. It is a broader concept than emotional intelligence. And emotional intelligence is the comprises of the self-awareness, self-regulation, and social awareness. And there are some difference between these two types of intelligence. The definition I already described the definition of the social intelligence and the emotional intelligence. The use of social intelligence is to make decision for current scenario, and in the use of emotional intelligence is to make decision for future perspective. The type of skill in social intelligence is interpersonal skill. The type of skill in emotional intelligence are interpersonal skill and interpersonal skill. Both are same. Type of skill in the social intelligence interpersonal skill, and the type of emotional intelligence is intrapersonal. So the person's own skills is important, not same. And the depth of social intelligence are sometimes an extension or superset of emotional intelligence, and depth of emotional intelligence are not as broad as social intelligence. It's a very narrow end. That means social intelligence is broad term, emotional intelligence is in the very narrow term. Emotional intelligence is for person intrapersonal skill. Social intelligence is the types of skill, the interpersonal skill. And social emotional clinical practice for medical professions is very important. That is the competency and the skill area and the description we said. The personal competency, the self-awareness, self-regulation, and the social motivation, and knowing oneself, managing oneself, and sentiments and passions that facilitate the attainment of goal. And the social competency is the empathy and the social skill, that is the understanding of others and compassion towards them, and expertise in inspiring others to an agreement. That the social agreement depends on the social interpersonal skill of the social intelligence. The clinical practice, we need to be service orientation in the social skill or the social emotional intelligence, that the anticipating, recognizing, and meeting others' need, especially the patients. Communication, that is the listening deeply and opening as well as sending clear, credible, and convincing messages. Interpersonal effectiveness, being attributed to others, demonstrating sensitivity and having the ability to relate well to all kinds of people. And it is a very powerful influencing skill. There's a building effective tactics for persuasion, and the building trust between the persons, that is the being trustworthy and ethical when working and relating to others. The social and emotional intelligence can build bonds between the patients and doctors and other professionals, nurturing and maintaining relationships, cultivating a wide network, and connecting with others in a deeper rather than superficial relationship. It can use in our practical life, prevent burnout, maintaining empathy, avoiding emotional attachment with the patients and other persons, allow for effective leadership. That means effective leadership is very important in the clinical practice, and one of the core component of effective leadership is social and emotional intelligence. And what are the benefits of high emotional intelligence in healthcare? That is the improved communication and teamwork, ability to respond well under pressure, increased empathy, better quality of care, and greater career satisfaction. And how to develop one's emotional intelligence and emotional quotient, EQ, what we say, EQ or EI, what we say. That is the self-awareness, the ability to know your emotion, strength, weaknesses, drives, and goals. Self-management is very important, the ability to stay calm when emotions are running high, adaptability. Empathy is very good component of the emotional quotient and emotional intelligence, that is the identifying with and understanding the desires, needs, and perspective of others. And social skill, that means some social engineering, managing relationship and resolving conflict to more people and move people in desired direction. That is the social skills. And at last, I conclude the session by saying to develop better healthcare service, interpersonal communication is skill and use of EQ are very essential. This soft skill need to develop from early childhood, from family and from education institutes. Medical curriculum need to modify and give more stress on interpersonal communication skills. And thank you all for patience here. Thank you all.